We stand our own dear native land, though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign, in peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed. When the green lowlands and swampy plains of the new colony
Okay. Thank you very much, Chisom. I think we have to recognize certain persons. I think I can see the digital vice chancellor of our great, unique university, distinguished Professor Obunari Abraham George Will, the sixth vice chancellor of the university. We have the DVCs and the others, including the chairperson for the day and the guest, the keynote speaker. Thank you very much and welcome. So I think I can go ahead and give my welcome address. So this is a welcome address presented by Professor Best Odinoha at the day dedicated to public health education, first scientific conference of the University of Port Harcourt School of Public Health, holding virtually on Tuesday, 16th September 2025. The Vice Chancellor, sir, the Vice Chancellor, distinguished Professor Obunari Abraham George Will, the DVCs here present, the provosts and the deans, the provost and the deans, the chairperson of the day, Professor Antoinette Ofili, Professor of Community Medicine and Public Health, and a key official of the postgraduate medical colleges in Nigeria, one of my trainers during my residency training program in community medicine and public health. The keynote speaker, Professor Sam Olufemi Sanwobo, Professor of Public Health Parasitology and Epidemiology at the Federal University of Agriculture, Abeokuta, President, Parasitology and the Public Health Society of Nigeria, a Rivers man that trained and blossomed in Abeokuta. The panel discussants on the theme of the day, postgraduate public health education in a changing society and disease landscape, Professor Kingsley Patrick Iwayan, PhD, Professor of Nutritional Biochemistry and Toxicology, and a scholar of the Harvard School of Public Health, Boston, United States, Professor DST Ogaji, a double doc, medical doctor, and doctorate degree holder. We have a third person here. I'm not sure she is in the best emotional state to fully take part in the panel discussion. She is Dr. Stella Rotifa, medical doctor, consultant, public health physician with the Federal Medical Center, Abeokuta. She just lost her dear son, who was an anonymous of the University of Port Harcourt. I think we'll I'll crave your indulgence for us to just observe a 1 minute silence in honor of Dr. Femi Rotifa. May the soul of Dr. Femi Rotifa and other faithful departed rest in the bosom of the Lord. Amen. I have to recognize other distinguished guests. I want to especially recognize Dr. Wisdom Sawyer, MNI, the head of the civil service of Bayelsa State, and Professor Florence Ndoka, former chairperson of our academic board and recipient of the School of Public Health Gold Award, professors, lecturers, and supervisors of the School of Public Health. I want to specially recognize Professor Tobin West, my deputy, and former acting CMD of our teaching hospital, UPTH. Professor Alice Nte, my mentor right from the medical school days, and past and present lecturers of the Department of Preventive and Social Medicine, including the retired ones, Navy Commander retired Dr. Alabere and Dr. Blissmore, the management and staff of the University of Port Harcourt School of Public Health, colleagues, students, ladies and gentlemen. It is with great honor that I welcome you all to day 2 of the first annual scientific conference of the University of Port Harcourt School of Public Health, the day dedicated to postgraduate public health education. The University of Port Harcourt School of Public Health was established in January 2019 by the Senate of our great university as a semi-autonomous academic center to provide postgraduate education in public health and the allied health sciences. The semi-autonomy of the University of the University of Port Harcourt School of Public Health gives it the powers to set and collect fees, and then to use the collected fees to run the programs subject to the rules and regulations of the university. This gives the school the wherewithal to recruit and pay ad hoc lecturers from within and outside the university and from the industries to lecture in its academic programs. So in so doing, the school has an edge over the other universities in the country in the recruitment of the rich of talents in the NGOs, private and public organizations in Nigeria, ensuring that it has world-class faculty with diverse background, experience, and training. The school started with 4 academic programs, but currently has 3 PGD programs, 10 master's programs, a Doctor of Public Health program, and PhD programs in all the subspecialties of public health. Academic programs in the University of Port Harcourt School of Public Health are deliberately designed to be both academic and professional, to sharpen the research skills of the students and prepare them for a career in the academics, while emphasizing the practical skills that are needed for professional work. The result of these have been very remarkable, as the graduates of our various programs often secure employment few months after graduation, such that we are having problems with the early release of their certificates, of course, because of the 2 processes involved in it. Once you have a certificate of the University of Port Harcourt, you can be sure that the student earned it. Okay, so the admission requirements of our academic programs are liberal enough for anyone desiring to specialize in public health to enroll irrespective of their background. This is because our School of Public Health subscribes to the definition that defines public health as anything done to protect and preserve the health of the general public. This can be the modification. This can be the modification of the screenplay of Nollywood movies to serve health educational purposes. Hence, the liberalization of the admission requirements of our PGD public health program to allow for the art students to be admitted and trained as public health theater artists. Okay. The liberal admission policy also allows for the admission and training of graduates of even religious studies, such that they can become new breed chief priests of communities, able to foretell potential threats to the health and well-being of the whole community, and capable of instituting remedies that are not only culturally acceptable, but also scientifically sound, just like orthodox public health practitioners. We have been successful with this liberal admission policy, as a large number of our students who were admitted at the inception of our school 6 years ago have completed their doctorate programs and are now gainfully employed in jobs that benefit from their dual background. Experiences have, however, taught us that students need to be trained on the following to become very good public health practitioners, especially as we are not just interested in awarding certificates. We want to award certificates that can be used to secure gainful employment. So we believe that education, they should have good understanding of diseases and other health-related conditions, a good knowledge of the distribution and determinants of the health-related conditions in the community as is taught in epidemiology, and a good understanding of how disease control efforts need to be implemented to achieve the desired results. Health-related conditions are so many and so varied that nobody can claim a full knowledge of them, let alone a novice being trained in a one-year academic program. This is one of the reasons for the publication, for the publication of the International Classification of Diseases and Disabilities by the WHO, to precisely define the health-related conditions, and with the WHO definition of health includes such social issues as poverty and gender-based violence. So in public health, and in fact the rest of the health sector, going by the WHO definition of health to include social, physical, and mental well-being, it means that social issues can be considered a problem, just such as poverty and lately gender-based violence. Let me say a little more about gender-based violence, because it's currently a topical social problem, with the crusading campaigns of N1, NAWOJ, women lawyers, and other women professional organizations. Why the obvious types of gender-based violence have significant adverse health effects, the inclusion of several culturally and even religiously accepted practices as forms of gender-based violence make nearly every man in Nigeria a violent person. Growing up in my village, a story used to be told of a man who was able to convince his new girlfriend to spend the night with him on their very first date. He acted as everyone would want him to act, and he kept saying to the girl, lie well, until day breaks. Students need to be constantly reminded to keep in mind the official definition of health-related events, and not only their own understanding of what they are. I once examined at University of Benin, and the student, they did a study and they reported over 90% of medical students in UniBen using substances. And when I checked, I just observed that their definition of substance abuse actually also included use of drugs without a prescription. So that ballooned the prevalence of substance abuse to ridiculous levels. So students will have to be constantly reminded to stick to the official definition of health-related events, especially as they sometimes differ from their own understanding of what they are. In public health, it is not enough to know these symptoms and signs of a health-related event. The knowledge must extend to the distribution and determinants of the health-related condition in the community. This is taught in epidemiology, which is not only the science of public health, but also its diagnostic tool. Again, the WHO definition of health complicates the issue as the causes of health-related events are no longer just microorganisms and vectors that preoccupy the early practitioners of public health, but now include chemicals like heavy metals, physical hazard like noise and radiation, as well as social issues. Experts in these emerging causes of ill health are not traditionally considered as health workers, but they should be brought in to teach postgraduate students in public health, especially if they are able to apply their knowledge. Public health is also a profession, and epidemiology is its diagnostic tool. Students in public health programs therefore need to be taught epidemiological study designs, not just for their research projects, but as a diagnostic tool and a way of gaining a deeper understanding of the health problems of the public. Students must be given the requisite epidemiological skills to enable them question everything. For example, certain widowhood practices tend to portray us as savages. Watch Rivers, N1 Rivers State just reported practices in Abua, one of the ethnic groups in Rivers State, where widows are sometimes forced to drink the water used to bathe the corpse of their husband. But I then ask, but are there better forensic methods of safeguarding a polygamous man from the love portion of feuding wives in a pre-scientific society? So it's not just enough to report such. We must look at the background stories. And that's why qualitative data collection methods are also encouraged in public health research. Okay, so can anyone truly claim to be a public health practitioner without having the ability to implement public health program, even for a single health event? I personally don't think so. So students in public health programs need to be taught the different tools of public health interventions that include health education, health policies and legislations, and the use of biomedical technologies like diet, drugs, vaccines, and other health commodities. Lectures on these health tools should be taught preferably by lecturers with industry experience and should be as practical oriented as possible, including the use of case studies. Students also need to be taught teamwork, system thinking, and methods for ensuring the participation of members of the community and other stakeholders in the execution of the health programs. I doubt if students in public health programs in Nigeria are adequately taught the importance of teamwork, as the programs are often hosted with the exclusion of some public health practitioners. Some of the programs are domiciled in the Faculty of Clinical Sciences and taught by community physicians, while others are taught in the Faculty of Public Health or the new NUC created Faculty of Allied Health Sciences and taught almost exclusively by non-doctors. There is also a plethora of umbrella public health professional associations in Nigeria, including the Society of Public Health Professionals of Nigeria and the Parasitology and Public Health Society of Nigeria, which our keynote speaker is the national president. The University of Port Harcourt School of Public Health at its inception sought to build a multi-faculty, multidisciplinary school of public health after the fashion of world-renowned schools of public health by seeking accommodation in the Ofrima House building of the faculty of the university's faculty of science. This was, however, viewed as a Trojan horse of the medical school and violently resisted. We must shun all interprofessional rivalries and work to create a single umbrella society to work towards a practitioners registration board that will set standards and regulate the training and practice of public health in Nigeria. The chairperson of the day, the keynote speaker, and panel discussants on the theme of the day we are choosing because of their unique qualifications and experience. The chairperson of the day, Professor Antoinette Ofili, medical doctor and professor of community medicine and public health with the University of Benin, is one of the most respected community and public health physicians in Nigeria. She is a key official of both the West African College of Physicians and the National Postgraduate Medical College of Nigeria, the postgraduate training institutions of medical doctors in Nigeria. While the keynote speaker, Professor Sam Olufemi Sanwobo, is a parasitologist and professor of public health parasitology and epidemiology with the Federal University of Agriculture, Abeokuta. He is also the president of the Parasitology and Public Health Society of Nigeria. He received a World Bank funded postdoctoral training and useful field experiences in Zambia, Ghana, Sierra Leone, where he refined and perfected the expertise in the control of several neglected tropical diseases, including hematiasis, schistosomiasis, malaria, lymphatic filariasis, and onchocerciasis. I'm sure he will share some of the secrets of his success with us. The panel discussants on the team are also public health practitioners with diverse experience and background. Professor Casey Patrick Iwayan is a professor of nutritional biochemistry and toxicology, but is also a scholar of one of the premier schools of public health in the world, the Harvard School of Public Health. Professor Gaji, of course, a double doc, and he also holds a medical doctor with a PhD, and of course, Dr. Stella Rotifa, a medical doctor and a postgraduate medical educator with masters in medical education. I have no doubt that they will do justice to the choosing team of the two of our conference. Sit back and listen to these experts. Welcome and thank you.
Thank you very much, Director, for that welcome address. It was all encompassing. So we'll make progress in the course of the program by inviting the chairman for the opening speech and remark, Professor Antoinette Ofili, Professor of Community Medicine and Public Health, and a key official of the postgraduate medical colleges in Nigeria. Professor Ofilima, you have the floor. Yes, Professor Ofili, please, if you can hear us, you can unmute and speak.
Okay. I'm sure that Professor Philly is getting ready. Very organized. In fact, she called me. Um, eh, she called me this morning. Hello, ma. Okay. Sorry,
I can't
I'm not
unmute.
sure.
Okay.
Yes.
Okay.
Okay, ma.
Hello. Hello.
Yeah.
I was
Good day,
having a
ma.
problem on muting.
It's all right, ma. You can
I
you
share
can go
my
ahead,
slides,
ma.
please?
Yes, you can. Can she? Okay, share your slide, ma. So after that, we'll take the citation of the keynote speaker, and then we'll go to this keynote address.
I'm having problems sharing.
So if you
Okay.
can you zoom? Can you highlight her? Okay. Sophie, I don't know if you.
Yes, I'm
if you
already
don't
there.
mind if you turn on your video. That is if you.
Okay.
Yeah. Oh, okay.
Okay. Maybe I'll
Sorry.
turn it off
Yes,
later.
and you know
Let me start.
we have our vice chancellor attending physically. Sorry,
Okay.
not physically, but of course virtually. Yes, our vice chancellor. Yes.
Okay. Okay.
Hello, sir. Okay. Okay, you can go ahead and read it out. Professor
I'm
Philip.
trying to start the video, but I'm having
I think it's
some
coming
challenges.
up. Yes, it's coming up.
But you can see my screen.
No, it seems it's trekking to Port Harcourt. Okay, you can go on so that will not.
Okay. Good morning, everyone. I'm sorry I'm having issues here, but I hope you can hear me.
Yes, we can.
Okay. So the Vice Chancellor, University of Port Harcourt, the Deputy Vice Chancellor, Research and Development, Dean, School of Graduate Studies, Center Leader, Director, Port Harcourt School of Public Health, keynote speaker for today, Professor Sam Olufemi Sawobo, President, Parasitology and Public Health Society. Then panel discussants, ladies and gentlemen. May I stand on the existing protocol and that the School of Public Health has actually has welcomed so many people. So I will start existing protocol. I welcome us all the first annual scientific conference. And alumni meeting health, University of Port Harcourt. Today is the day 2 of the conference, and it's dedicated to postgraduate public health education. I'm having problems changing this, so let me just move on. The sub-theme for the day is postgraduate public health education in a changing society and disease landscape, which will be delivered by Professor Sam Olufemi Samwobo. Public health is the science and art of preventing disease, prolonging life and promoting health through organized efforts and informed choices of society and organization in a defined community. It focuses on preventing diseases, promoting healthy lifestyle, and ensuring access to healthcare for all. The field of public health is broad. It is proactive rather than reactive, addressing the roots instead of the branches of health issues. The health of groups of people is looked at rather than focusing on one individual. Now, at the initial stage, the medical community resisted public health advocates, talking to them about taking a broader view of health. This was because they worried that focus on individual patients has been overcome. Every specialty is now speaking the language of public. The medical field has now seen there's a need to work on the root cause of the health problem rather than the branches. It has now been realized how necessary public health is in the overall health care. A postgraduate public health education prepares professionals to improve the health of communities by designing, implementing, and evaluating health promotion programs and policies, amongst other things. Careers in public health include epidemiology, people being epidemiologists, biostatisticians, health policy and management, reproductive and physical health, environmental health, disease control, health promotion and health education, occupational medicine, public health, nutrition, rehabilitative and social medicine, international and public health, etc. A postgraduate in public health education focuses on public health issues that are beyond the undergraduate level. It is an advanced academic program. The program educates individuals and communities about health promotions, healthy behaviors, and disease prevention, among others. It empowers people to make informed decisions about their health and well-being. Skills and knowledge in postgraduate public health are required to control, predict trends of diseases and health-related events. Now, it leads to diverse careers like being community health physician, being a public health nurse, health educator, community health specialist, health promotion manager, policy analyst, wellness program administrators, etc. Now, the developing countries are having issues. There is a significant proportion of disease burden in the developing countries where we belong to. Now, Nigeria is facing many challenges, such as disease burdens, overpopulation problems, emerging and re-emerging diseases, neglected tropical diseases, emergencies and disasters, weak health system, inequity in accessing healthcare services, especially among the poor and the vulnerable population in rural areas. We also have the issue of globalization that has also increased these challenges. Many health-related issues, such as epidemics, we remember the case of COVID-19 pandemic and disasters occurring anywhere in the world, which can rapidly become a global threat because of the movement, the mass movement from one country to the other. Now, the developing countries are also undergoing school transition, increasing prevalence of non-communicable diseases. You have cancers, hypertension, diabetes, etc. In fact, some teaching hospitals now are recording the highest prevalence of morbidity being cancers. Now, also, there is continuing challenges of the existing communicable diseases that we also have. Now, these challenges are also compounded by inadequate number of doctors, nurses, and other healthcare workers, especially in the rural areas. Now, there's also low investment in health by governments, we are poorly equipped, poorly staffed secondary health facilities, and non-functional primary health care facilities, with the primary health care system in a state of near collapse in some places. Now, one of the solutions to these challenges is to ensure training of postgraduate public health specialists. Now, the training equips the trainee to address these challenges and to provide leadership for healthcare workers in the community in order to improve the health status of the people. While I was listening to the director, I actually love what he mentioned about teamwork. All of us coming together, different groups of people trying to ensure that we improve the health status of the people. The public health workers deal with the roots and not the branches of the health condition. And they focus at the health of groups of people rather than focusing on one individual at a time. Now, the theme of today, postgraduate public health education in a changing society and disease landscape, is very timely. Let us relax and enjoy the conference. Thank you. God bless.
Thank you, Ma. So
I'm sorry, my net, I don't know what happened, but
it's all right. It's all right. It's all right. We understand. We understand. Thank you very much, Professor Antoinette Ofili, the chairperson of the day. I think we'll move quickly and take the citation of the keynote speaker. The keynote speaker, Professor Sam Wobo, is already on call and waiting to give his keynote address. Yes, please let's have his citation.
Professor Sam Wobo won a unanimous vote to give the keynote address on Day 2 of the first annual scientific conference of the University of Port Harcourt School of Public Health. He won the vote for his ability to combine research and practice in public health, for being an engaging lecturer, research supervisor, mentor, and most especially as the president of the Parasitology and Public Health Society of Nigeria. Professor Sam Olufemi Wobo hails from Rumeme in Obiapo local government area of Rivers State and obtained an HND from Rivers State University before furthering his education at the Federal University of Agriculture, Abeokuta, where he earned his BSc, MSc, and PhD in parasitology in 2005. He received postdoctoral training and valuable field experience in Zambia, Ghana, and Sierra Leone, where he refined his expertise in the control of neglected tropical diseases, including helminthiasis, trypanosomiasis, schistosomiasis, malaria, lymphatic filariasis, and onchocerciasis. These trainings include the World Health Organization Training of Trainers course for neglected tropical diseases in the African region at Lusaka, Zambia, international course on strengthening contemporary school health, nutrition and HIV prevention programs at Noguchi Memorial Institute for Medical Research, Accra, Ghana, entomology techniques training for multi-country black fly migration research at Makeni, Sierra Leone. Professor Sam Nwobo has been head of departments, center director, journal editor, program manager, and has excelled in all these roles. He was transformational in all these positions with emphasis on competence-based education, translational research, and community service. As a professor of parasitology, Professor Sam Nwobo's research focuses on neglected tropical diseases, and he has supervised several master students and more than 20 PhD students. He has published more than 130 previewed articles and 14 technical reports, which are used as protocols for the control of neglected tropical diseases such as helminthiasis, trypanosomiasis, schistosomiasis, malaria, lymphatic filariasis, and onchocerciasis. Several of his research studies were donor-funded, having received research funding from WHO, Asino Pharma Limited, PATH USA, and the Federal Ministry of Health. Distinguished guests, lecturers, students, ladies and gentlemen, behold Professor Sam Olufemi Sam Nwobo, a Riversman who trained and blossomed in Abeokuta, Fellow of the Zoological Society of Nigeria, Fellow of the Parasitology and Public Health Society of Nigeria, National President, Parasitology and Public Health Society of Nigeria, Director of FUNAB Zoological Park, WHO AFRO Consultant on Neglected Tropical Diseases NTDs, keynote speaker at Day 2 of the first annual scientific conference of the University of Port Harcourt School of Public Health.
Welcome, sir. I hope you can share.
No, you can share for me.
Yes.
That I sent it to you.
Has it muted? Okay. Okay. Hello, sir. Can you?
Hello?
Yes, sir.
Good morning, sir. Yes, you can share my slide.
Oh. Okay, let me I know you sent it earlier, but I think I said it. Sorry, I need to quickly. Okay, you can start the preambles while we let me download it from
Good morning, everybody. I'm happy to be here to present one or two things about postgraduate health education. First of all, I want to recognize the Vice Chancellor of the University of Port Harcourt, SPH-UNIPORT, the management team. I also want to recognize the management of the University of Port Harcourt School of Public Health, led by our own brother. I also want to recognize the chairperson of today, Professor Antonietta Fili, and the panel discussants. Standing on the existing protocol, I want to appreciate all students, ladies and gentlemen, to this conference. Thank you. I'm presenting a small paper on postgraduate public health education in a changing society and disease landscape at the first scientific conference of the University of Port Harcourt School of Public Health. I have some outlines as introduction, societal challenges associated with public health, postgraduate public health education, core areas in public health curriculum, benefits of postgraduate program in public health, challenges associated with postgraduate public health program, and finally, conclusion. Can I continue?
We are about to...
Hello, can I continue?
Yes, sir, you can. You can continue, sir.
Okay. Introduction. Public health is the science of preserving and enhancing the health of individuals and their communities. And it has a goal of protection of the health of all populations, which can range in size from a tiny local neighborhood to a whole nation or region of the world. And this is accomplished by promoting healthy lifestyle, studying injury and illness prevention, identifying, preventing, and treating infectious diseases. The changing society. Our society is dynamic and undergoes significant transformation with time in its values, norms, institution, environment, and technological advancement. This change is caused by diverse factors, including demographic shift, social movement, cultural evolution, economic factors, and globalization. The impact of this change may be noticeable in behavioral change of the population, institutional adaptation, standard of living, disease distribution and landscape, and overall health status of the citizenry. Disease landscape. This refers to the comprehensive analysis of the various factors that surround a given disease, such as the biology, available treatment, market trends, and the competitive environment. A scientific understanding of these factors enables researchers, policymakers, and pharmaceutical companies to formulate control and treatment strategies. Examples of diseases with changing landscape include infectious diseases, neglected tropical diseases, and chronic diseases. Societal challenges associated with public health. There are common societal challenges associated with public health and concerns, and these include environmental quality like clean air, water and food, sanitation, climate change, health equity, health reform, access to health care, infectious diseases, mental health, injury, and physical activity, in addition to nutrition, obesity, and vaccination. If we begin to look at infectious diseases, they range from wide range up to HIV, and of recent was the COVID-19 that streamlined the whole world into a single platform. You can also look at the environmental crisis, which occurs when the environment changes due to human activity and its significant impact on environmental stability, resulting in health risks such as pollution, deforestation, and climate change. Most of them are noticeable in Rivers State and part of the Niger Delta. It is estimated that 7 million premature deaths are caused by air pollution alone each year globally, highlighting the necessity of effective public health initiatives. I recall one time I came to Port Harcourt and I was traveling through back to the Choba Emowa axis. I noticed the black suit, the black smoke suit that was there. And when I made the inquiry, they said people were burning, trying to refine the local way of getting diesel and everything. The environmental hazard of it is also about the air pollution, because people get polluted, and it will have caused a lot of deaths. And I know that the University of Port Harcourt Teaching Hospital has record of some of the deaths that occurred due to those air pollution. The other issue has to do with healthcare disparities. Vulnerable population continue to suffer from disparities in healthcare quality and access. This difficulty is demonstrated by notable difference in maternal mortality rates between the high and the low income nations. And these difficulties highlight the demand for qualified public health specialists. I want to appreciate the opening remarks of Professor Phile, who extensively leaned on the remark of the program manager that initially the medical school were at conflict, but noting that they don't have the overall manpower, I think they've given space to now the School of Public Health and public health institutions to begin to interface to be able to bring this healthcare disparity closer. In looking at this, the University of Port Harcourt School of Public Health invited me to talk on postgraduate public health education. And what is postgraduate public health education? It's a graduate level degree program designed to train students to protect and improve the health of communities. As earlier stated, it is also driven by factors such as globalization, urbanization, climate change, and pandemics. As a result, postgraduate public health education must adapt to equip professionals with the knowledge, skills, and competencies needed to address these emerging challenges. Postgraduate health education refers to the educational processes that provide students with knowledge and skills related to various aspects of public health, including the biology, environmental factors, communication, data management, epidemiology, health policy, as well as emergency management. As a postgraduate degree candidate in public health, one should learn how to foster better health through education, research, and the promotion of best wellness practices. A graduate student of public health is expected to take courses in population health, determinants of health, nutrition, biostatistics, epidemiology, and other things like public health policy. The core areas in the public health curriculum, like I've mentioned, include epidemiology, biostatistics, environmental health, health policy and management, social and behavioral sciences, health education and promotion, global health, maternal and child health, chronic disease prevention and control, and infectious diseases prevention and control. And most of this curriculum, the lists are inexhaustive. I go to what are the benefits of a getting postgraduate program in public health. There are some advantages of anchoring a postgraduate program in public health in a higher institution of learning. And I want to sincerely commend the University of Port Harcourt School of Public Health. You are a trailblazer. Your story will be told in the next 20 years, the impact of what you are doing today and what you are doing to the country, Nigeria. God will continue to bless the UNIPORT School of Public Health. Some of these activities are lined up in community and public, institutional, societal, and personal benefits. What are the academic and research benefits? They are interdisciplinary. The availability of postgraduate public health programs promotes interdisciplinary collaboration, which in turn fosters creative research and solution. The organizer, when in his opening remarks, talked about the flexible curriculum where they allow even students in performing arts to come in. And this also helps in a lot of collaboration because the people in theater arts will also help to advance knowledge in terms of communicating the activities of postgraduate training to the populace. There's also the advanced education, which draws top talent and generates qualified workers. There's also the research opportunities, where students are engaged in top quality research, publications, and they also attract grants. By and large, there's also the area of critical thinking because public health demands a lot of critical thinking. Critical thinking in the sense that must we continue to do the same thing and get different results? No. That means we have to think differently to get meaningful, useful results. The other area has to do with community and public benefits. In terms of community engagement to address health issues and advance initiatives, collaborating with communities. There's also the health promotion and education. There's the workforce development area, which are benefits of the community. Then when you come to institutional benefits, it enhances the reputation of that particular institution and the program. And I know that with this program today, the assessment of UNIPORT as a top university in the world will be further enhanced. And I hope that the Vice Chancellor will give also due credit to the University of Port Harcourt School of Public Health and to support them because they are helping to advertise and promote UNIPORT globally. This program is being watched all over the globe. And we want to appreciate the School of Public Health UNIPORT for doing this for the university. There's also the issue of interdisciplinary collaboration, also the grant and funding opportunities where you write good proposals and you attract good grants. And when you attract good grants, you also use this grant to also solve public health problems. There is the societal benefit, which involves improved population health. The postgraduate public health program can help to improve public health outcomes by conducting good quality research and educating public health professionals. It is also evidence-based in that the program can also help address issues and influence policy decisions by offering evidence-based solutions and also by addressing health disparities. If you come to personal benefits, as a postgraduate public health student, there's also the career advancement that helps you in having a rewarding experience for those who are passionate, I underline the word passionate, about improving population health. It also helps in increasing your potential that can lead to higher salaries and greater job security. It also enhances your career opportunities as a postgraduate degree in public health can lead to advanced roles in research, policy, and practice. And it also helps you to have specialized leadership skills in areas of epidemiology, health policy, global health, and environmental health. Students can also develop leadership, management skills, and also communication skills. And I want to say that with my background in public health, I've been able to interface with heads of government in countries. And I know that the same thing is also applicable to the students if they also take seriously to this, their education. There are challenges associated with postgraduate public health programs. And these challenges, one could be academic. The academic in terms of that You may have rigorous coursework because postgraduate program in public health could be very tasking with multifaceted coursework and high expectations. There is also the challenge of research requirements because you may be asked, you may be given some timeline to work very hard to complete your postgraduate program, and this also involves compulsory thesis or dissertation. And this compulsory thesis or dissertation also means that you must also do the research study. And this could be time-consuming and challenging. There's also a challenge of interdisciplinary nature, which you may need to navigate other fields, taking into consideration that if you must have an open mind that you could get into other fields. You may come from a different background, but if you are given a topic or a study into another background, you must also learn how to adapt and come out. And this could be some challenges, but I know that if you are passionate about it as a student, as somebody wanting to get a good certificate in public health, you will surmount it. There are also some professional challenges, which could be due to limited job opportunities, because as you move up the ladder, the job opportunities could become limited. But if you are creative, if you are innovative, it does not pose as a problem. It poses as a solution to you. And you must also continue education. Don't say that I've gotten a master's or a PhD and that is the end of it. The world system is a continuing place for a lot of things, and we must also continue to look at issues, get more knowledge, look at latest research, look at latest technologies, and look at what are trending to come up. I will recall that during the period of COVID, there was a WHO report that that was in April 2020 that within a particular period of time, a number of Africans would have been dead and all those things. But they noticed that when they got to June, we did not even get up to 3% of their this thing. And they began to look at what would have been the thing. And they found out that there were a lot of things associated with Africa and the tropical environment that made it difficult for the COVID-19 virus to thrive. So you must continue as an individual to also continue to improve on your knowledge about research. As you go to the field, there are some challenges that could come, like in NTDs, we'll also sit back to look at what are the things that could hinder NTD from being eliminated, from being eradicated in Nigeria. You continue to go through all those research. Then there are also the issue of personal challenges, your time commitment, your financial burden, and the emotional stress. Like I did tell some of my postgraduate students yesterday that if you want to succeed, you must play down on emotional stress, play more on your passion and your commitment, and you must also meet timelines. If your professor is telling you submit, or your lecturer is telling you submit your material at so and so in a week's time, don't wait for that 1 week. The moment you leave your class, go on and do that assignment. Submit it well ahead of time, because anything will happen. I say anything will happen that will make it difficult for you not to meet up that timeline. It is better to meet up a timeline well ahead of time than to begin to give reasons or excuses why you couldn't meet them up. There are also the field-specific challenges, which has to do with addressing health inequalities. You're also working with various populations and staying current with emerging issues. Sometimes you find yourself going to work in a riverine environment. Sometimes you find yourself going to work with in a strong rural environment, you must adapt. I recall during one of our WHO study in a very rural community where we are looking at the black fly migration. We got into a community and they offered us drinking water. And when we looked at the water was slightly brown in color. My community engagement mind came in. If we reject that water, then they will not participate in our study. So what did we do? We took the water, but after taking the water, we went also to take preventive measures so that nothing will affect us. So you must note that you must avoid stigma in working with different types of people in different communities. And that is where your knowledge of public health, your total knowledge of the public health comes into place when you go into the field for research work. And you must stay current with emerging issues that have to do with pandemic, issues that have to do with climate change, issues that have to do with your technological advancements. In conclusion, a functional postgraduate health education must continue to evolve in response to the emergence and re-emergence of the disease landscape and societal needs. This can be accomplished by preparing public health professionals to address trending issues and advance health equity through a combination of cutting-edge courses, hands-on training, and global perspective. I mean global perspective. All things considered, a postgraduate public health program in a university like UNIPORT will equip the students and health professionals with advanced knowledge and relevant skills that will in turn help community, help the society, help the academic community, help the university, and in a way help Nigeria. Thank you very much for inviting me. I want to sincerely place on record the support I received from Professor Florence Nduka, asking me to please accept this invitation. And I want to also appreciate Professor Lebare Bole for also helping with this presentation. Thank you very much, University of Port Harcourt School of Public Health. Thank you.
Thank you very much, sir. Thank you. Let's give him a standing ovation. The keynote speaker for the day. Thank you very much, Professor Sam Wobo, for such an eloquent presentation. Thank you very much, sir. Thank you.
Thank you, sir. Thank you.
Yes, so thank you very much, sir. I think we can make progress. I don't know if our ninth Vice Chancellor is still around. I don't know if you want to make one or two comments before we'll take a short break, and we'll take a short break. We'll take the cultural display, and after that, we will go into the panel discussion. Remember, we have three distinguished public health practitioners as our panel discussants: Professor Kingsley Patrick Iwayamu, PhD, a professor of nutritional biochemistry and toxicology, Professor DST Ogaji, professor of public health and health system management, with a medical doctor and a holder of a PhD. We also have Dr. Stella Rotifa, who I'm sure will be substituting. We have, I think we can come in, I personally can come in as a substitute. And I know that our distinguished chairperson, Professor Philip, can also chip in one or two things if she's called upon. Thank you very much. So let's just have a short cultural display as an interlude before going into the panel discussion. Can we have it? Are you giving us, okay, yeah, this one is different from that yesterday.
Oshiriho wa menu nwa yukwere ya bụ gbada dide gbada so gbada mudide nwa yukwere nu so sini bu ni unwe gbada dide gbada sanwa ya sanwa abe ya don egeme mi na
Please, while the performance is on, Golden, we need to see you at the stage area. And Aloysius Mbata, please also make your way to the stage area. Thank you. While the cultural display is on, Golden, please make your way to the stage area. Aloysius Mbata, also make your way to the stage area. Thank you. And
Nance Nebra, Amaganga Bra. Oui. Iria way. Iria way. I'm the Miami Nibelero. In settings of this magnitude, you normally see our women dressed in our cultural costumes and attires. We are going to be training you with various dance steps, quite unique to the Calabar people and indeed the Ijaw nation. It is indeed not an easy task. The young lads have to pass through rigorous training. Amagangabra. Please, they deserve a round of applause, please, ladies and gentlemen. Obra Farinabri, Amanaba Pasisi. Omelama.
Okay. Thank you very much. I hope you enjoyed those cultural dances. So we are getting ready to start the next item, which is the panel discussion. At least we have Professor Daprim Ogaji on the call. We are still expecting Professor Patrick Iwean to join. But at least we can start with Professor Ogaji. Professor Ogaji, sir, are you there? You have the unique experience of undergoing the residency training program in public health. And you also went ahead and you took a master's in, I think, quality assurance in Finland, and before getting a PhD in the UK. Professor Ogaji, can you just tell us about your experiences as far the training you received, especially abroad, because we know what the situation is with this residency training program. Sorry? Professor Ogaji, if you don't mind, if you can just indicate by raising your hand so that we can see you and recognize you. Professor Ogaji. Anyway, I think I have to thank you for the effort you have made to join, because you are attending to a medical emergency, but you have also decided to, but you are taking part. So thank you very much. We appreciate. Is he there?
It has muted me again.
Professor Ogaji, sir.
All right, thank you so much.
Okay.
I want to appreciate my vice chair. I've unmuted, but I check from your end if you are hearing me. Are you hearing me? Can you hear me?
Okay. Yes, we can.
Please.
Oh, this is sir.
Okay.
You can go ahead. Okay. Sorry, Professor Ogaji. I don't know. Can we give
yes, please.
the VC?
Okay.
Okay. Okay, go ahead, Professor Ogaji. Okay, and Professor Patrick Iwean has also joined. Professor Iwean, welcome, sir. Professor Ogaji, you can go ahead and tell us your experiences with when you did your master's in Finland and then your PhD in the UK.
All right, thank you very much. I trained as a public health physician first in with the National Postgraduate Medical College of Nigeria, and that's a specialty training, which is more like, although all are competency-based, but it's more like an apprenticeship training to become a fellow or a consultant. I subsequently went on to study healthcare quality management in the University of Helsinki, in primary care, basically in the University of Manchester in the United Kingdom. The experiences are actually very important. All the experiences, both at the fellowship pathway and also the degree pathway, are very important in molding public health experts in this day and age. And we cannot decountenance anyone, for the other. They're all equally important. But what is more important is the skills, that we garner when we go out. My insistence in the first instance was that having schooled in the University of Port Harcourt, I want a situation where I'll be exposed to systems that I considered some of the best in the world. So my choice of education was to go for institutions that were ranked at that time among the best 100 in the world. And the University of Helsinki and that of Manchester were among that group. So learning there actually brought in a lot of exposure, not only about public health, but also about university systems, university administration. Certainly in life, you can't give what you don't have. So some of the outputs you see are result of exposures of individuals, where they have gone through. And so opportunities that avail themselves with us having to study outside these climes, understand how systems operate. And with that clear understanding, it's easy for us to be able to, implement some of these actions within the local context. I think that's what those experiences contain. But talking about putting that in line with what we are discussing today, we see that public health is a rapidly changing environment. And so when we develop curriculum, which is one of the things I learned when I was in Manchester, we must develop curriculum in line with the context and also the setting in which we are dealing with. Although our public health knowledge half-life is not as short as that of clinical practice, but it still behoves that every 5 years we must evolve. And evolution requires that we must understand current trends, and see how public health fits into this space. So within the University of Port Harcourt context, we see where we're able to expand public health, to become an all-commerce environment, that has really led to the growth of and access to public health training. And I believe this has highly benefited both Nigeria and other African countries, where talent have been raised, in the area of public health. And these are all, to my mind, aftermath of exposures, with trainings in other climes. I'll stop at this point so that other panelists can also speak, except.
Okay, thank you very much. We'll come back to you. I know that Casey has joined us. Casey, welcome, sir. Sorry, you were at another occasion, another conference where you were the keynote speaker. Please, can you have been the director of programs of ACE-Puto, and so what will you recommend? What will you recommend to improve public health? Postgraduate public health education in Nigeria, considering your experience in the U.S. as a scholar with the Harvard School of Public Health.
All right, thank you, Director, School of Public Health. And I also want to appreciate the presence of the Vice Chancellor who is here today and other participants. I also want to thank the keynote speaker for the wonderful lecture that he delivered earlier on. Like you said, Director, the postgraduate program in public health education, is seen to be moving towards a more adaptive, interdisciplinary, and system-oriented approach. I mean, by equipping students with broad set skills, for instance, data science and all that. And it's been a transformative journey for the School of Public Health and ACE-Puto by extension that effectively, empowers, and equipped educators to become agents for positive change. Now, using the ACE-Puto and School of Public Health as a model, that we have actually, gained a lot of successes in the area of curriculum development, collaboration, and by this, we extended our ecosystem to include people from even outside the area of public health, toxicology, or nursing program. We also have been able to develop, very broad curriculum, like Professor Gaji just mentioned, and widening our courses, and develop, wide courses in areas of bringing people from the industry, from government agencies, and even, resource persons from different areas. And this has actually helped us, to get enough students, who have shown interest. And if I'm not mistaken, the School of Public Health and the ACE-Puto happen to be one of the, very few centers in the University of Port Harcourt that have attracted not just, local students, but regional students and even students from the international community. So with all this that we have been doing, and we have also developed policies. And most importantly is the adherence to academic calendar. And in Esputo, we run a program for 12 calendar months for the MSc PhD program, and then 36 calendar months for the PhD program. And we have strictly adhered to this. And we used to tell our students that there's no dull moment in any of these centers. And that has really improved, the quality of education and the delivery as well. And then the use of, ICT has also helped to improve our programs, and then looking at the use of the LMS, which has also made students to participate actively in lectures, wherever they may be, within or outside the country. So here, which has helped us to develop the courses. We have, developed courses integrating things like climate change, things like tropical diseases. And just recently, we have developed another program in One Health. So these are some of the things and improvements. And by and large, we are very happy that we are also extending these gains to the university generally. I think I'll also stop here for now so that for others to also make their comments. Thank you very much.
Thank you. Thank you very much. Thank you very much, Casey. If you don't mind if I call you that. Professor Gaji. Hello, sir.
Yes, sir.
I don't know. Can you tell us of the kind of lecturers that taught you in those your academic programs abroad? Were they all?
Yes,
were they all the traditional health workers, or were they from different fields? Or what kind of lecturers were they?
I think that's a very interesting point, and it's important to note this because when I was in the University of Helsinki in the Department of General Practice, that's under the Faculty of Clinical Science. Now we have the director was a general practice physician, and then his assistant was a nurse. And it's very important to note this, and all the resource persons they were using were people that came from collaborating centers. Now, the University of Helsinki at that time was a collaborating center with the World Health Organization for the development of human capacity, in health. So you have people coming from the WHO, people coming from the Johns Hopkins, and different places, to give lectures, and training, and then go. So we were exposed with this kind of multidisciplinary and interdisciplinary setting, which actually made a lot of sense. In our university today, there are still a lot of wards. There are wards set up by either faculties or departments, that tend to restrict, the transdisciplinary nature of learning. And I think this is one of the areas that AC Puto and the School of Public Health have been fighting to breach, So we are able to see that people come together, whether you are in parasitology, in biochemistry, we can come together because public health, we need to deepen the science of public health. At the University of Manchester, specifically in the Institute of Population Health, we had people that were psychologists, you have the biostatistician, and they come from different fields. As a matter of fact, my supervisor, Professor Stephen Campbell, started as an economist, and came into healthcare, and became a professor of healthcare quality, and he sought for, he was at that time one of the best 5 in the world, and we see this kind of migration. So one of the things that happened in University of Port Harcourt precisely in 2013, with the introduction of graduate program in public health, was that it enabled a lot of students to have a career shift. People have done basic pharmacology, anatomy, and so on, and then they're able to migrate into public health, and they're becoming very useful to the community. We see them in different spheres of life, excelling, as public health practitioners, and thanks to the introduction of those graduate programs. So public health can be seen as an opportunity where people, from various walks of life can come in, and there is space for everyone. So we can have all kinds of faculties come into public health, we can also have students come in, and learn public health. And I think we are beginning to see that the beauty of that evolving in the public health training ecosystem in the University of Port Harcourt. Thank you very much.
Thank you very much, Professor Gaji. Professor Patrick, do you want to say something on that? Yeah, muted.
Add more to some of the
Okay.
benefits. Some of the benefits that our students have actually gained as a result of the successes recorded by using the ACE Tutor model and the SPH model. For instance, when you talk about the career advancement and specialization, you all know that our nursing program is one of the most successful nursing programs you can think about in this sub-region. And this has also helped to open doors, so people, to pursue their careers in government agencies, in international agencies and all that. And also, we have also helped to develop, a skilled workforce. A lot of agencies come to draw from the candidates or the students who graduate from these programs just because of the skill sets they've been taught. So there are so many advantages and so many benefits, and also we also help students and our candidates to develop their skill workforce. We also help them in, this has also helped in strengthening the health systems, because we all know that so many graduates, nursing graduates who have finished school in the last 1 or 2 decades have actually come back to school. And we have given them that reassurance that they can still be relevant even in the 21st century when we talk about the AI age. Thank you very much, Professor Best. And I think I need to leave now for my lecture.
Thank you very much,
all right, thank you,
Casey. Thank you very much. I think we appreciate. Thank you very much. So you can go about the other businesses. I think what we can get from their submissions. We have there's need for teamwork. We have to break down barriers. And unfortunately, people are busy erecting them. In fact, even in the School of Public Health, I've had cause to teach in community health, public health nutrition. And in fact, I remember giving a lecture, and someone in public health nutrition actually challenged me. Yes, especially in the management, dietary management of diabetes. And I was just wondering, I, as a medical doctor, was taught from physiology, so I know the normal workings of the human body. I was also taught pathology, so I know the normal pathophysiology of diabetes and the rest. And I've also done a lot of research on the staple foods of staple Nigerian food, and I was just wondering why he had where he got the effrontery to challenge me, even when perhaps he did. Anyway, let me not go there. Professor Gaji, what are your specific suggestions? I know you have been in at the forefront of these making these changes, and these changes that have yielded positive results. What are your suggestions? How do we move forward?
Yeah, our suggestions is for us to have this dynamic approach to I would call it institutional building, understanding that the only constant in our world is change, and we must embrace this change. You recall that when we started the graduate program at the midpoint, we were able to have some resources to undergo accreditation, both national and international accreditation. And one of the imports of accreditation, especially at the international stage, is the fact that your program should be seen to be evolving, and we've been keeping track of that. And these accrediting bodies, which was the Royal Society of Biology, and we keep track of that. Every year we are told to write a report on how the changes that have occurred. So every 5 years, we are expected to revise the curriculum, and that's about the half-life of public health knowledge, unlike clinical medicine that is 1.5 years to 2 years, like I said. So every 5 years, curriculum reform will be important, program design, and that also has affected the School of Public Health, as well. We also need to strengthen our research capacity. To my mind, it's not within the capacity area, but the depth of our research. And that is by reinforcing multidisciplinary, interdisciplinary, and transdisciplinary research, like we emphasized during the ceremony or the keynote lecture yesterday. And we need to strengthen that. We also need to look at the area of globalization and see how we can globalize our research and also our training. This is very critical because public health is not just seen as local, but international. So within the global health space, we need to see how what we do within the local context interfaces with that of what is going on in the global health. And as a cross-cutting issue, looking at how we can improve access to education, especially public health education, is very important. We have had some discussions around how do we bring in our religious leaders, to understand more about public health, setting up programs, for public health and religion, like we see in the hills and other Ivy schools. We need to look into that. We need to expand. The School of Public Health has obviously done well in expanding to 13 disciplinary areas in public health, but there's still a lot more to be done, and we can work out along with others, the sociologists, the anthropologists, the religious people, to see how to expand our coast and make sure that public health is all embracing for everyone and everyone has a piece of the action. And I think that's what we need to be doing going forward. Thank you.
Thank you very much, Professor Gaji. So we'll continue to collaborate or seek the collaborations of the other faculties, including those in humanities. In fact, I actually descended from a long list of native doctors. So somehow I became interested in traditional medicine, and I think I have to renew that collaboration with that Department of Religious Studies to see if we can start a program on African traditional medicine. That will be nice. That will be nice. Thank you very much, Professor Gaji. Thanks for your wonderful insights and your contributions. Thank you very much. And I know that that emergency will be successfully resolved. Thank you very much. I think we are moving towards the end of this particular section. And let me also say that at the end of our conference, there will be a communique. A communique will be released, and as much as possible, we will try to publicize it and then inform all the necessary stakeholders. And let me also thank the Vice Chancellor, who is the academic leader in the university, for his participation. So, which means that at the end of when we'll be sending out the communique, some of these things will not be completely strange because he had it in course of the conference. Thank you very much. So, okay. So I don't know, Professor Philly, Professor Sam Wobo, do you have anything to add before we move on to the vote of thanks? Professor Philly, Professor Wobo, Sam Wobo. Okay.
Hello, can you hear me?
Yes, sir. Go on, sir.
Yes, thank you very much. I want to appreciate your two lead discussants. It shows that the medical people are opening up now. Unlike before, where they believe that if you don't study medicine, that you don't have anything coming to do with public health. And with what they've submitted, that means that it's better your School of Public Health and other schools also enrich themselves with knowledge of all other areas of study. This will benefit the students greatly. You know, like you talked about anthropology, you talked about, because even in public health, there's one key area, which is community engagement, community participation. And most times it's done by people who are not health professionals. They're people who are maybe the social scientists, the anthropologists, and the humanitarians that can come in. So if you open up your space, and by that extension, all other people who want to copy from you, open up their space, the public health postgraduate education will be more enriching in Nigeria and beyond. Thank you.
Thank you very much, sir. I think we are exploring that. We are collaborating with a lot of persons. For example, when I was given the task to tackle the mosquito situation in at our teaching hospital, I had to work closely with the entomologist in the university, and we were actually able to diagnose or pinpoint the mosquitoes, or the mosquito that was causing the main problem. And when we were able to pinpoint it to the coolest mosquito, it made it easier for us to tackle, because we were looking at everywhere, including the fact that that hospital is built on a swampy ground, and we are saying, how do we control this? And when we were able to pinpoint it to coolets, we actually found where they were breeding. They were breeding in the underground service tunnel of the hospital, which, because of poor plumbing, sewage was discharging there into that place, creating almost like a 1,000 pit latrine beneath the hospital, and that was causing the mosquito problem. So we wouldn't have found that that solution if not the fact that we enlisted the services of an entomologist. So thank you very much. We are trying. Just as I also pointed out, it's not just medical doctors, even non-doctors are also skeptical. I was talking about when we started, we actually went to that faculty of science. We wanted to create a more multidisciplinary school. And what's happened? In fact, I was told that they summoned an emergency faculty board meeting, and from that meeting, they went and tore down our banner and every other thing and chased us out of that place. I was later told that they thought we were the Trojan horse from the medical school. So, but I think we are becoming friends. We are now friends with those in Faculty of Science and even other faculties in the university. So we are making progress, sir. Professor Okfili, do you have any comments?
Yes, please. I will just add that public health is for everybody. Everybody. So there is space for everyone. And so we need to continue what we are doing, because if you recall that even in the medical profession, when public health started, and other specialties found it very as if it wasn't a clinical thing. So, but we've really moved on, and I think we should continue. Like, for example, I'm very happy with the School of Public Health. For example, looking at bringing in Faculty of Arts to it. Because if you look at music and you look at sports, these are very key things that affect health. If you look at music, for example, even just listening to music can affect somebody's psychological state positively. So I'm happy that even the arts are coming in. So public health is not for only doctors, it's for everybody. And I'm happy that School of Public Health is looking at it from that perspective. So I think we should just continue what we are doing in the field of public health, and try to continue the collaboration, and then continue to review our curriculum, and then the teamwork, and we'll get better and better every day. Thank you.
Thank you very much, Professor Philly. So I can go ahead and give my vote of thanks. Okay, so let me first of all thank the Vice Chancellor, Professor Owunari Abraham Georgewill, for all the assistance and for attending this conference in spite of his very busy schedule. I'm sure that he would have, in a typical day, he attends more than 3 official engagements, and he manages to attend them all, giving his vital inputs, and of course his presence. His presence is usually enough to make us to sit up. Thank you very much, Mr. Vice Chancellor. Thank you for all the assistance as a person, and more especially to the School of Public Health. Let me also thank the DVCs and all the other management of members of management of our great university. Thank you very much for all the support. Usually I also thank the Dean Graduate School, because they are supervisors. They are our direct supervisors, and I am actually very, very grateful to this particular dean, the current dean, Professor Mekanwa Anil, for his supportive supervision. He's not a taskmaster, but gives us as much support as we need. So if not for the graduate school, perhaps we would have found it difficult to graduate more than close to 200 students every year. It could have been very difficult, but we are able to do that because of their support and encouragement. Let me also extend gratitude to the Associate Dean, Professor how will I forget Obuchi, and the GSO, Mrs. Iyagba. Thank you very much for all this support. Let me also thank my provost and my dean for all their support and encouragement, and then lecturers of the School of Public Health, particularly those in the community medicine in the university, in the teaching hospital, and preventive and social medicine in the university. Thank you all for your support, your encouragement, and of course for making me sit up. In fact, each time, and of course, let me also add for their constructive criticisms. Each time Yes, they usually will whip me. They usually whip me in line with their criticism. So I thank you very much and I appreciate. Then the staff and the staff of the School of Public Health, especially the admin staff, led by our own registrar in quotes, Mrs. The admin secretary, and then and all the others, all the other staff. Then our technical partners, Daniel Okon, Chima Nwoke, Chisom, Chisom and Joko, the young elder, and all the others. Thank you very much for everything. We are going to continue next. We are going to continue tomorrow, and that the tomorrow's section will be on the practice of public health, public health practice, and we have also chosen a very experienced persons to anchor that day. Dr. Adeze Ore, the 27th Commissioner of Health of Rivers State, will be the chairperson. And then the keynote speaker is Dr. Kenneth Tafa, the president of the Association of Public Health Physicians of Nigeria. And then we also have discussants. We have Dr. Wisdom Sawyer, who is currently the the head of the civil service of Bayelsa State. Dr. Nera Kadiri Nosvera Nsigbe, Dr. Godin Ohunda, people with vast experience in public health. They will be involved in tomorrow's occasion. We are going to close now, but we are going to have the scientific section. We couldn't have it yesterday, but we will have it. We'll have it. But we are going to start with those unrecorded abstracts. So students can make their presentation starting, I think, 4 p.m. today. They will make their presentations, but they will present in live. They will not. We will not be playing any of the recorded videos. But so if you have your slides ready, you can just prepare for the presentation. And we are starting by 4 p.m. Please note that the time you have just 6 minutes to make your presentation. 6 minutes to make your presentation. And to tell you the truth, 6 minutes is even a lot of time in a conference setting. So make sure you are able to present within that time. So thank you very much. And so we'll take the closing formalities now, starting with, I think in reverse order, the national item, and then the item of our great institution. Thank you very much. So let's have the national item, please. Please, let's all stand for the national item.
Nigeria. justice reign, in peace or battle honored, and this we count as gain. To hang unto our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed. On the green lowlands and swampy plains of the New Calabar River stands the University of Port Harcourt, a citadel of learning and excellent education, a home of academic enthusiasts, searching for knowledge and wisdom, enlightenment, excellent reliance on mission. Our hope in the future is rooted in God. The vision of our fathers shining in the stars, opportunities unlimited and equal. Our progeny citizens of the universe, from far and near, the pride of Uniport, because unique, Uniport, unique, Uniport, unique, Uniport.
Refreshment for those of you on site, online, and for those of us on site, we have some low calorie snacks available. Thank you very much. So I see you by 4.
In closing, can we just take photographs, virtual photographs? So please turn on your video as we take our virtual photograph. And also to those of you streaming on YouTube, I want you to put on the chat box where you're watching from to make it rich. Thank you and thank you. Thank you all. Okay, the next slide. Next slide. All right, that's the last. All right, that's the last. Thank you very much. See you in the afternoon session.
you.